pharmacist at Aravind Eye Hospital, Madurai. I'm delighted to be here with you all today. In this presentation, we will explore the storage and handling of medications and the importance of proper storage and handling of medications for maintaining their quality and safety. To achieve this, we will ensure our storage environment is clean, secure, well ventilated, and has controlled humidity and temperature. We will discuss in detail. And here's how we manage our inventory controls. The medicines are purchased from our wholesale distributors and stored them properly to provide a uniform supply of drugs to the patients. When receiving a medication, we check each item with their invoices. It includes name of the item, batch number, quantity, MRP, and its rate and expiry date, and name of the supplier, total amount, bill number, and discounts. If any damaged or short-ED expiry medicines are found, they will be returned to the supplier. Only the safe, effective medications are maintained. And after receiving the medications, we arranged in alphabetical arrangement across all the dosage forms. For example, drops, injections, ointment, and tablets, etc., with a proper labeled container. The organized storage systems helps to easy identification of drugs and quick retrieval, which saves times and reduce medication errors. And by managing and storing the proper medications, will maintain the stability and potency for a long period. Let's discuss some key guidelines for maintaining our inventory properly, including using a proper storage containers and some inventory control techniques like FIFO and FIFO, and regularly checking of expiry of medications. This leads me to my next point, FIFO and FIFO. FIFO, it means first in, first out. It ensures the product stored first need to be retrieved first and used first to minimize the risk of expiry medications. On the other hand, FIFO, that stands for first expiry, first out. It prioritizes the products whose nearest to their expiration date, it used first and sold first, no matter whenever its arrival. In this picture shows early expiry medicine should be kept in front and later expiry medicine should be kept at the back. Both the methods aim to the products closest to their expiration date, it's used first. And the next topic, look-alike medication and sound-alike medication arrangement. To avoid mix-ups, we implemented the color code systems. First, look-alike medications confused due to a similar packaging and its appearances. So it's marked with purple color code. And then sound-alike medications have spelling similarities and similar phonetics, which is arranged with yellow color codes. When it comes to medicinal storage, temperature maintenance is crucial. We have two types of temperatures. One is room temperatures, typically below 30 degrees Celsius, and another is refrigerator storage, is between 2 to 8 degrees Celsius. To ensure compliance, we check the temperature thrice a day, and the reading should be noted in a temperature log form. If any issues arises in a temperature log form or instruments, we promptly replace it and service it. And all the maintenance activity, including its date and time, should be carefully recorded in a temperature registers. And the another important storage is high-risk medication storage. The high-risk medications are the drugs that can cause serious harm if it is used incorrectly. To minimize the risk, they are stored in a separate cupboard which is in red color with a lock. And only the pharmacist access the medications and dispense to the patients. And also the separate register should be maintained for this. And another is narcotic medications. And narcotic medications are the strong painkillers that can be addictive and dangerous if it is misused. And then the two staff members are responsible for overseeing them. It's stored in a double lock key systems. And it also the separate register should be maintained. And what to do with near expiry medicines? In our hospital, we follow the policy of medicines that 3 months before to their expiration date, it mentioned as the near expiry medicines. Identify the medicines with while purchasing and the daily physical stock verifications, and collect the medications and label as the short expiry medicines and return to the suppliers. And move on to the next topic, single dose vials and multi-dose vials. Single dose vials, for example, Dexa, it to be used on only one patient and discarded after the procedure is done. And these vials are typically lack of antimicrobial preservatives. On the other hand, multi-dose vials, for example, methylene blue, it contains more than one dose of medications will be injected to a different patients. And you notice that multi-dose vials typically contain antimicrobial preservatives, helps to prevent a bacterial growth. And working with multi-dose vials, we should follow the proper protocols. Always check the label whether it is a multi-dose vials and check its expiry date. And mention the date and time when the vial is opened. And the multi-dose vials are used only for 48 hours after its opening, and never combining the doses from different vials. On the next topic, how to use drops, do's and don'ts. And when using eye drops, always check the expiry date before it's used, and discard the solution within a month after its opening, and close the bottle tightly after its use, and make sure to maintain good hygiene to prevent the infections. And the first image is showing the expiry date of the drops at the back of the bottle, and the second image shows its opening date, that is when the bottle is opening. It's mentioned at the bottom of the drops. And don'ts. Do not share your eye drops with another persons, and do not allow the dropper tip to touch your eye, and don't mix multiple types of eye drops. By following these guidelines, we ensure the safe and handling of medications. Let's prioritize the patient safety by the following steps. Thank you.